Hello, welcome to Veterinary Anatomy of the Craniocervical region. Today we're going to talk about this anatomy in preparation for the technique classes that we'll have on Saturday. Just a kind of a neat slide showing you the horse and human and the common parts of each. And obviously horses walk on their middle fingers, their third digit through life. Be aware of blind spots when approaching animals. Horses and carnivores view the world much differently. Obviously, a horse is a herbivore, and they're going to be primarily focused to the side vision as they have their heads to the ground eating grass. Humans have about 140 degrees of vision, binocular vision, with 170 degrees on each side all the way out to their peripheral vision, but they have this large binocular view. Canine dog carnivore has this binocular view right in front of their head for tracking prey, and then they have this about 150 degrees peripheral vision on the sides. You can just see out of one eye, so be cognizant of that. When you deal with, here's a carnivore, the cat on your left shows you this degree of binocular vision in the center for tracking prey. But if you look at the herbivores, here's the rabbit and here's the horse, really no binocular vision. They have this lateral vision, this unilateral vision on each side, where the eyes point to the side because they have their heads down grazing, looking for obviously prey animals, things like that, preying on them, but pretty large scope of vision just in one eye. They say with a horse that you have to expose them to something on both sides of their heads. So in other words, you got to show them if you're going to show them a bale, you're going to stand on whenever you're doing your adjusting, show it to the left eye and then to the right eye, because their brain processes things differently. Horses have this blind spot right in front of their nose that they can't see. They also have a blind spot right behind their head, or excuse me, right behind their tail. They can't see either. So back here there's a blind spot as well as this one in front. Let's talk about the skull of the dog first. The canine, we have three basic skull types: the metacephalic, the brachycephalic, and the dolichocephalic breeds. The metacephalic, the average dog skull, what you think about for your beagle, something like that. Brachycephalics are your peaks, your pugs, your losses, your shih tzus. These little punched-in face dogs have a lot of dentition issues because of this. Then the dolichocephalic breeds are your long-nosed dogs, your bourgeois, your collies, your sighthounds, if you will. A couple structures we're going to look at: zygomatic arch, the orbit. The dog does not have a bony orbit. The dog has a soft tissue orbit. And this is significant, especially when you're dealing with dogs, from the aspect that you don't want to put, especially these little punch-nosed breeds, your pugs, your peaks, your Boston Terriers, these type dogs. You got to be careful about putting too much pressure on their skull. You can actually prolapse the eyeball. Skull shapes predispose dogs to various issues such as dental problems, TMJ problems, things like this. We're going to talk about all this as we go through this. Here's your dolichocephalic breeds, your long-nosed dogs, metacephalic, your medium-nosed dogs, and here's your brachycephalic breeds. Here's the skull differences. You can see when God made a dog, God made a wolf, and had this longer nose, and we created issues when we took this nose and shrunk it down, and we definitely narrowed or shortened the nasal cavity, and we kind of just punched all the teeth, if you will, back in toward the dog's head. These dogs have lots of dentition issues, things like that. But you can see on this picture of this skull, there is no real bony orbit. It's really soft tissue. They have the zygomatic arch, which would come across here, but the eyeball doesn't sit in an orbit like it does in humans. There's not a bony orbit there, so pressure here can actually prolapse eyeballs. Here's the bones of the skull, the incisive bone, the nasal bone up here. This is the maxillary bone, the zygomatic bone for the zygomatic arch, the frontal bone, the sphenoid bone here, parietal, the occipital bone, the temporal bone, which is where the styloid process is, and the mastoid process back here. More of a top view, or just a dorsal view, if you will. Nasal bone, maxillary bone. Here's frontal bone. You can see this large, well-sprung zygomatic arch, and the reason for this is to allow for the huge temporalis muscle that dogs have. We'll talk about that more here in just a little while. But here's the temporal line for the attachment of the temporalis muscle. Here's the occipital bone, the sagittal crest, what people commonly call the smart bump in dogs. The skull again, there's that zygomatic arch. And again, there's the orbit. And it's not a full bony orbit like we think of in people, so that you can cause issues. There's an infraorbital foramen for branch of the maxillary nerve for sensory sensation to the skin of the nose, here, the face. Here's that zygomatic arch. Again, it's well sprung. Well sprung means it's pushed way far laterally to allow for that huge temporalis muscle in dogs. There's that sagittal crest. They say, and I don't know if it's ever been researched, but supposedly the bigger the sagittal crest, the smarter the dogs. They call it the smart bump. Here's the mandible. Here's the mental foramen for the mental nerve on the dog, a branch of V3, which applies sensory innervation to the lower jaw. That nerve actually runs inside the jaw. Here is the inferior alveolar nerve, which enters in here through the mandibular foramen. There's that huge coronoid process for the attachment of the temporalis muscle. So it's where the temporalis muscle inserts, is on this coronoid process. There's the condyle for the TMJ. So coronoid process, have the body, the angle, the ramus of the mandible. And there's that mental foramina. The mental foramen, there's usually two of them. Mental foramen, body, is called the angular process. There's that condylar process, the condyle, for the TMJ, and there's that coronoid process again. Dogs have deciduous teeth, like people do. These deciduous teeth begin to erupt usually around 4 to 5 weeks of age, and about the time that the bitch will stop nursing the puppies. A bitch will usually wean the puppies off between 6 and 8 weeks to get those little teeth, and they cause her a lot of discomfort and pain. Most all of them are in by 2 months of age, the deciduous teeth are. Permanent teeth begin to erupt between 5 and 6 months of age, sometimes earlier. Usually a good indicator of the dog's age is those canine teeth will come in right about 6 months of age. The upper fourth premolar is called the carnassial tooth or sectorial tooth. It's a huge crushing tooth. It's the largest cutting teeth in the upper jaw. It's designed to shear and break bone and things such as that. So it's a huge tooth, and it's an important tooth for a dog to try to maintain in the mouth. A good veterinary dentist will try to maintain that tooth if at all possible. There's that carnassial tooth, the upper fourth premolar. And you can see that zygomatic arch. There's that coronoid process, and then that whole area is occupied by that temporalis muscle. There's a lower first molar, there's a carnassial tooth. Big crushing tooth. Important tooth in dogs. The TMJ, temporal mandibular joint, we'll do some temporal mandibular setups on dogs and TMJs. Dogs who are involved with bite work, police dogs, attack dogs, things like this, Shih Tzu trained dogs, they oftentimes get TMJ issues. Common complaints with TMJ issues in dogs: they won't chew their hard food, they won't play tug of war, they're constantly yawning, trying to reset their jaw. It is the TMJ in dogs is a hinge joint primarily, very little to no lateral type motion, grinding effects, no protraction, retraction like you see in people and other animals. Horses, cows obviously have a lot of grinding type rotational motion in their jaw in order to grind the grain and hay and stuff that they eat. Not so much in dogs. Dogs don't really chew per se. They just rip and swallow. And you've all seen this. If you've offered your dog a prime morsel of your steak that you cook for dinner, and you've saved a good piece for the dog, and the dog just takes it and swallows it without even thinking twice, and you're like, why didn't you chew it? Why didn't you enjoy it? So it is a hinge joint, a synovial joint there, and it's that condyle of the mandible, and this trough that sits on the temporal bone, the mandibular fossa of the temporal bone there. There is an articular disc, but it's a very thin disc, not near as well developed as in people and other animals. Talk about a scissor bite. Correct bite is a scissor bite, which is a slight overlap of the front teeth over the bottom teeth, these incisors. So you get this slight overlap here. This is an overshot jaw. See these in a lot of small breeds of dogs. And here's an undershot jaw. We see this in bulldogs, things like this. Here you have this normal occlusal surface. You see this scissor bite, the front teeth slightly overlap the lower teeth. A pincer bite, which is the teeth hit dead on. These are all incorrect or abnormal bites. When we're evaluating the TMJ in dogs, we want to look at the bite, look at the alignment of the teeth, and oftentimes you can see malalignments of these teeth that you can correct by adjusting the TMJ or the mandible itself. Muscles, temporalis muscle, we mentioned that. The temporalis muscle is a huge muscle in dogs, much larger than you and I. In humans, it's paper thin. In dogs, it's an inch or more thick. But then their jaws is a much different type of motion. In dogs' jaws, it's more of a scissor bite as opposed to ours, which is, we chew, we grind. So it elevates the mandible, innervated by V3, the mandibular division of cranial nerve number 5. The master muscle on the side, I'll show you a picture in a second, is also that closes the jaw or elevates the mandible. And the parotid duct crosses halfway over this, and I'll show you a picture of that in just a second. There's really no lateral or rotational movements when chewing in the dogs, again, innervated by cranial nerve 5, V3, the mandibular division. The pterygoid muscles, they lie medial to mandible, lateral pterygoid and medial pterygoid. Medial is larger than the lateral. The function is to raise the mandible and draw it slightly inward. Here's temporalis muscle in a dog, orbicularis oculi. Okay, here's this parotid. There's a parotid salivary gland. Here's the parotid duct right here. Here's the masseter muscle. And these are all branches of the facial nerve, innervating muscles of the face. In equine, let's look at these structures in the horse. So we go through this, facial crest, things like this. Here's the horse skull. We have several horse skulls for you to look at, for you to observe while in class. Ramens of the mandible, body of the mandible. There's that mental foramen for that branch of V3, the mental nerve. There's the infraorbital foramen branch of V2. There's that facial crest. You can palpate that. Horses have this bony orbit, much more of a bony orbit shape than dogs do. Here's a coronoid process of the mandible. And you can see how small the temporalis muscle is comparatively to the dog. Again, the horse does elevate and depress the mandible, but a lot more masseter muscle mass. Here's where the masseter sits on the horse. There's that condylar process of the mandible. And we'll teach you in class to find the TMJ, both the dog and the horse. Find the zygomatic arch. And then the horse, just go to find the zygomatic arch and go between there and the ear. Here's the external acoustic meatus. So it's right there between the zygomatic arch and the ear to find this TMJ. And we'll teach you lateral mandible and things such as this. So you see this bony orbit in the horse. Horses have what are called hypsodont teeth. They grow continually throughout life. And they have to maintain the occlusal surfaces and wear them down as they eat. If there's not good occlusion here, normal occlusion between the upper and lower teeth, we tend to get spurs and hooks on these teeth and can cause problems and pain. And horses have to have their teeth floated by a veterinarian, someone who knows what they're doing. Here's a TMJ again. Again, here's a facial crest, this line right here. Here's the occipital condyles back here, called the pericondylar process right here beside the condyles. The TMJ, there's the external acoustic meatus. There's that zygomatic arch. So find the eyeball. Just basically take between the eyeball and the ear, draw a straight line. There you'll find that TMJ on the horse. You hear about wolf teeth in horses. Here's a wolf tooth. Here's a canine tooth. These are often pulled. The TMJ of a horse, again, here's a TMJ. Horses have this area in their jaw, lower jaw and upper jaw, where there are no teeth, called the diastema. The diastema is this area with no teeth, just gum there. The canine teeth are usually present in both sexes, but rudimentary and sometimes fail to erupt in mares. Wolf teeth is that first premolar. Usually only in the upper jaw you find a wolf tooth, and that's often removed. There's a thick intra-articular disc present here in the horse because of this grinding motion, this lateral motion. That disc allows the jaw to move laterally to grind. It's primarily hinged, but there is side-to-side motion for grinding, for eating hay, things such as this. The joint supported by a lateral ligament, a very fibrous lateral ligament. And there's one that's caudal, that's more of elastic fibers in it. This helps support the TMJ of the horse. You see the size of the mandible in the horse compared to a dog, and this huge masseter muscle sits here. This condylar process is a segmental contact point for a TMJ lateral, adjusting horses. And we'll teach you that, to do that maneuver. Muscles, again, the master muscle in a horse is huge compared to a dog. Facial crest, zygomatic arch down to mandible. It's a multi-pinnate muscle, which means it can move in multiple directions. Functions to elevate the mandible, draw the mandible toward the active side, with lateral and rotational motions for grinding, innervated by V3, the mandibular division of the trigeminal nerve. Here's that huge masseter muscle. Here's a facial nerve in the horse. So you got to be careful when you're massaging on this side of the horse's head, because you hit that facial nerve, it's going to cause some pain and discomfort. Temporalis muscle, relatively speaking, it's much smaller in the horse than it is in the dog comparatively size-wise. It does elevate the mandible. Horses have well-developed medial and lateral pterogordius muscles that produce grinding-type motions of the jaw. They're deep to the mandible. Here's a masseter. There's a lateral pterygoid, and there's a temporalis muscle. Medial pterygoid. Spinal column of horses and dogs. We'll spend some time, as I said, adjusting the mandible. The dog, we'll talk about rostral mandible and TMJ lateral. And horses will mostly TMJ lateral with a horse. Spinal column, we'll spend time here. This is a very complicated area. Here's a pretty good picture of the skull of a dog. Here's the atlas. Here's the axis. Here's C3, so C1, C2, C3. Now, you veterinarians are very familiar with this. You chiropractors, this looks entirely different than a human atlas and axis. The transverse processes or wings of the atlas are very large structures, very easy to palpate, and you're going to be surprised, chiropractors, how easy this atlas is to palpate in dogs, and how easy it is to get purchase order to adjust atlases. I see a lot of atlas subluxations in dogs. Kind of digress a little bit. Here's that zygomatic arch. There's that coronoid process in the mandible. There's this huge area occupied by this temporalis muscle. Okay, on the dog. And again, the TMJ, the temporomandibular joint, is right here. So just find the zygomatic arch in here, and it's just right there. Makes it easy to find. Vertebral formulas. Vertebral formulas are basically the number of vertebrae in each different region of the animal. The canine has 7 cervical, 13 thoracic, 7 lumbar, 3 sacral, and varies on number of coccygeal vertebrae depending upon the breed. Cats is the same, basically. 7 cervical, 13 thoracic, 7 lumbar, 3 sacral. Horse, 7 cervical, 18 thoracic, 6 lumbar, and this varies a little bit. We'll talk about the variations later. 5 sacral, and then about 18 coccygeal vertebra. Basically, all mammals have 7 cervical vertebrae, at least all the ones you're going to deal with, I'm sure. That's not true. There are some exceptions to it, but I've never adjusted one of these exceptions. Some exceptions include 3-toed sloths, which I don't see a lot of those, duck-billed platypuses. I guess if you're in Australia or something, you might encounter those. Sea manatees, maybe if you're in Florida, you might adjust a sea manatee. I've never known someone who did. Now here in Texas, the 9-banded armadillo, the Dactylus novemcinctus 9-banded armadillo, doesn't have 7 cervicals. But again, I've seen a lot of armadillos and chased a lot, but never adjusted one. So if you ever have, let me know. And then a spiny anteater is another one. And there's another couple of exceptions to this. The function of the vertebral column in the quadruped is stiffen the body axis. Posture, dogs have postures like people do. It's a quadrupedal stance versus a bipedal stance. It's extremely important in locomotion. It drives the rear legs, the rear limbs, and all that is based upon the flexibility of the spine. It does enclose and protect the spinal cord. Dogs and horses have intervertebral foramina just like people do, and obviously that's where the spinal nerve exits out the IVF. Typical vertebra in the animal, the quadruped, has a much larger body than that in the human, only because it's a horizontal versus a vertical orientation. The neural arch surrounds the vertebral foramen, which is where the spinal cord is. There's processes that attach the neural arches, the 2 lamina and 2 pedicles on each side. And of course, the vertebral notches on the pedicles is where we see the intervertebral foramen, which is where the spinal nerve exits. Here you can see this is a lateral radiograph of a dog. Here's the pelvis, here's the sacrum, here's the lumbar vertebra, here's the thoracic vertebra, and between each of these vertebral bodies is where the intervertebral disc is. Now, I know we have MRIs now, and I realize that that's the gold standard when it comes to diagnosing intervertebral disc disease in dogs. And it seems that a lot of the younger veterinarians are not taking near as many x-rays as maybe some of us older veterinarians did. But plain flat films are just a good screening device to try to determine if there is possibly a herniated disc in the dog's spine. This radiograph does show you that. You see this narrowing of this disc space right here. This is typically associated with herniation of the disc. You see this space is wider, okay, than this one, so therefore this is narrowed here, and then I would highly suspect this is a collapsed disc, herniated disc in this dog. In the dog, the intervertebral disc is pretty obvious to see here. It accounts for about 20% of the length of the vertebral column. The dog will continue to grow in longitudinal length for about the first 12 months of life, and then that usually stops. So once your dog's about a year of age, that's about as long as it's ever going to get. Intervertebral disc disease, very common problem in dogs, especially some of your chondrodysplastic breeds like your dachshunds, these type dogs. This is a skeleton of a dachshund. The cervical spine, here's your thorax, here's your lumbar, and it's these transitional areas that we see the greatest issues. The transitional area between the cervical and thoracic spine, between the thorax and lumbar, called thoracolumbar spine, or here T13L1. Back here the lumbosacral spine. These are where we see many of our issues in the intervertebral disc disease in dogs. The caudal cervical segments, or lower neck, is the most flexible portion of the cervical spine. Ventral flexion, lowering the head, is mostly a result of movement of the craniothoracic joints and cervical vertebra. They just bring them into line, basically. Fair amount of mobility of the caudothoracic and craniolumbar, and that's for sagittal flexion. And that's during, you see how much sagittal flexion is occurring here in this dog, the lumbosacral joint, the whole lumbar spine here, especially at this junction between the thorax and the lumbar vertebra. You see this greyhound, these rear legs are flexing, actually coming in front of the shoulders almost as this dog's driving forward. Cat spine's more flexible than a dog spine. They can laterally flex, allows the cat and dog to kind of curl up in a ball when sleeping, if you will. Cervical vertebra, again, back to this, the atlas. Atlas is huge in a dog, much different shape than in humans. This is called the wing of the atlas. Transverse foramen for passage of the vertebral artery. Lateral vertebral foramen, sometimes called dorsal foramen, for the first cervical nerve. There is no spinous process on this vertebra, just like there is not in humans. There is no body. The atlas has two large lateral masses on each side. So I said the wing, this transverse process is called the wing, ala atlantis, or wing, if you will, of the atlas. Very easy to palpate, easy to purchase, and we're going to teach you atlas posterior right, atlas posterior left, atlas superior right, atlas superior left. These are all different listings of the atlas and the dog. The ventral arch, the dorsal arch. There's a facet right here for the dens from C2. Here's a good picture of this. Here's that wing of the atlas. This is a dorsal view looking down on the atlas. Here's another picture. That wing of the atlas again. The articular facets for C2. Here's a horse atlas. They say it looks more like a turtle shell, which I can see that. Here's this wing of the horse atlas. Again, very easy to palpate. We're going to palpate these in lab, and I want to make sure you can feel this. Pretty easy to feel. And definitely you want to get your hands on this, because we're going to be adjusting atlases starting tomorrow. Second cervical vertebra, called the axis. Axis, also called the epistrophius, is the longest of the cervical vertebra. In dogs, it has a very tall blade-like spinous process. The dens is the cranial articular process that actually articulates that ventral arch of the atlas. It's more of a rod in dogs and carnivores, whereas in horses and cows it's more like a spout. It looks like a spout for an old well pump. This is just looking dead on at the axis of a dog. There's that dens, there's those articular facets, there's that spinous process, there's a neural canal, there's a transverse process. Articulation between the atlas and the dens, or the axis. There's that odontoid process, or dens. You need to make sure on some of these breeds, especially these smaller breeds, these brachycephalic breeds, and that you, especially who are puppies or having cervical issues, you get proper radiographs of the upper cervical spine. This dens is a secondary ossification center, and sometimes does not unite, and or can be fractured. And when if you start adjusting the upper cervical spine of these dogs, and this dens is ununited or not connected, you can cause some definite cervical issues in the dog. So you got to be careful about this. Here's a great dorsal view of the atlas and the axis. You see this blade-like spinous process. Here's just a cranial view. There's the dens. There's a ventral arch. There's the articular facets for the occiput. So these actually articulate with the occiput for the atlanto-occipital joint. There's the wings of the atlas. There's that spinous process of the axis. Now, horse's axis looks different. You can see that there's a large, spinous process on this, but yet you see this more spout-like look. Like I said, it looks like an old, pump water fountain, or a water well, well pump that would pump water out of. This is a cat. Cat's atlas is shaped a little different. He still has a pretty prominent wing of the atlas, though. It's still there, still prominent. Here's the axis. There's the dens. Typical vertebrae, C3, 4, 5, and 6 are considered typical, which means they look like each other. It's hard to tell them apart. They become shorter as they approach the thoracic region. The spinous process is poorly developed in these cervical spines, except for C7, but there's a lot of variation amongst the different species there. The cranial aspect of the body, the cervical spine, is more convex, whereas the caudal body is concave. This increases the contact surface area, increases mobility of the cervical spine. The lamino-pedicle junction is important. You should underline this. This is an important concept. It forms kind of a shelf, if you will, or a trough between the transverse processes. So we'll use this to contact point for adjusting cervical vertebra. We talk about cervical listings. You can't palpate spinous processes of cervical vertebra in the quadrupeds. So we're going to talk about body listings. So we'll say cervical body right or cervical body left. It's a rotation of the body to that side. So in a cervical body right, the body of the vertebra rotates to the right. Now if there was a spinous process on that vertebra, when the body rotates right, the spinous process would rotate left. So from the thoracic and lumbar spine, we're going to use spinous process listings. So if I say T4, PL or posterior left, I mean the spinous process has gone to the left, but that means the body has gone to the right. So that's going to take a little bit of thought process, a little bit of, just stopping to think about what's being said. But in the cervical spine, we'll use body listings. The cranioarticular processes, which are going to form the zygapophyseal joint, or those articular processes of the spine. Facets face medial, cranial, and dorsal. So it's about a 45 degree angle, and we'll show you this in lab. So basically it's not in the thoracic spine, the articular processes for the facets are on more of a coronal plane, if you will. Basically lateral, so from lateral to medial. Coronal, if you put the dog into a bipedal stance, and a quadrupedal stance would be on a transverse plane. Okay, so more of a transverse plane. In the lumbar spine, those facets are more on a sagittal plane. So in that, those plane facet angles will determine the line of correction. So in the cervical spine, we're going to teach you 45, 45. So 45, if you drew a line just parallel with the vertebral column, okay, and come at your hands at a 90-degree angle, you go caudal 45 and up for dorsal 45. So it's 45, 45. We'll show you that in the lab. Okay, but that is your facet angle. That's your adjusting angle for the cervical vertebra. Whereas I said in the thoracics, it's going to be more on a transverse plane from lateral to medial. With the lumbar spine, it's going to be on more of a sagittal plane from just P to A or dorsal to ventral. Here's the cervical spine. This dog has some issues, but you can see the 45-degree facet angle right here. Here's C1. There's the occiput. There's the axis, the large blade-like spinous process. The bodies of the cervical vertebra much longer than the bodies of human cervical vertebra. A very short spinous process, very difficult to palpate. Can you see the other problem with this dog? Count the number of cervical vertebrae in this picture. Not all of them read the book. Not all of them read the book. But you can see the facets. This dog's got a narrow disc space here. This dog's got some issues with his neck, obviously. C7 is a transitional vertebra to thoracics. In humans, it's called the vertebral prominence. It has the largest spinous process. And if you reach behind your neck there, and chiropractors know this, but palpate that bump right there by your collar. That is the spinous process of C7 in most of us. Some of it's T1, most of it's at C7. The first palpable spinous process in people, you feel the EOP, the external occipital protuberance of the occipital bone, drop down about 2 inches, and you feel that first bump back there in your neck. That is actually C2 in humans. You won't be able to feel that in dogs because of the nuchal ligament. As far as those spinous processes of cervical vertebra, that's why we use the body, and we use the transverse processes to palpate cervical vertebra in the quadrupeds. Here's canine C7, transverse processes, body, neural arch, spinous process. The nuchal ligament. Humans have a nuchal ligament, and the purpose of the nuchal ligament in humans is to allow the spinous processes of the cervical vertebra to be shorter, which increases hyperextension of the human cervical spine. In quadrupeds, the primary function of the nuchal ligament is to support the weight of the head without using muscular involvement. So it's there to help support the weight of that head on that long lever called the cervical spine. Now, in canines, the nuchal ligament is more of a band or a cord. It's not near as well developed as it is in other quadrupeds. But it goes from the spinous process of the axis to the tip of the spinous process of T1, and from there caudally its continuation is continued as a supraspinous ligament. So the supraspinous ligament, which is a ligament that connects the tips of the spinous processes together, on the dorsal aspect of the interspinous ligament that runs between the spinous processes, the length of the spinous processes themselves, the cranial continuation of that supraspinous ligament is the nuchal ligament. As I said, it plays an important role in supporting the head. Interestingly enough, it's absent in cats. Cats don't have a nuchal ligament. Cats don't have lots of things. They don't have a nuchal ligament either. And here it is. Here is the spinous process of the axis. Here is that nuchal ligament. There's a supraspinous ligament. There's an interspinous ligament. There's ligamentum flava. And you see how short the spinous processes are, and you can't really palpate these, but you can feel the hills and the valleys here. Okay, what's called the lamina-pedicle junction. There's a zygapophyseal joint, that 45-degree facet joint. In horses, the nuchal ligament is very, very well developed. It really is. There's two parts to it. It's massively developed in a horse. You can imagine the weight of a horse's head and how much that would be to try to maintain muscular support to hold the head up all the time. But supports the weight of the head without interfering with the ability to lower the head for grazing. It has two parts. Each are paired. It has a dorsal funicular portion and a laminar portion. The dorsal funicular portion is a thick cord-like connective tissue. Basically extends between the highest spines of the withers and the EOP of the skull. It's flattened more cranially, then becomes rounded as it nears the withers of the horse. It blends in with the scapular cartilage of the horse, which is on the dorsal aspect of the scapula. It's also continuous with the supraspinous ligament, as it is in other species. The laminar portion basically fills the space between the funicular portion and the spinous processes of the cervical vertebra. I'll show you a picture in just a second. They're more elastic-like fibers. They kind of run in a cranial-ventral direction. And here's a good picture. So here's this funicular portion here, all the way up to EOP, down to the withers of the horse. So external occipital protuberance down. So it actually does attach to the head. Then this is the laminar portion, which kind of fills the space between the funicular portion and the spinous processes of the vertebra. Now you can see the spinous processes are very poorly developed in the cervical spine, if at all. And so basically when you're palpating a horse's cervical spine, you're feeling these hills and valleys, and the faculty will talk to you about the hills and valleys of the cervical spine, this lamellopedicle junction versus the hills, which is the zygapophyseal joint. So they'll talk about these lamellopedicle junction. So EOP, back to the withers. Now if you notice here, we'll talk about this in a second, but there's actually a little bursa located here to help decrease the friction as this runs over these bony aspects of C1, C2. So the cranial nuchal bursa, atlantal bursa, it's above the dorsal arch of the atlas. Infection of that bursa is an old condition called poleval. The equine vets will tell you about that. The caudal nuchal bursa, which is here, is not always present above the spinous process of the axis. And there's a supraspinous bursa, which is over the spinous process of T3. T3 it's the most prominent aspect of the withers, and inflammation there can cause what's called fistulous withers. So this bursa right here, and that's always there. And although we don't see it as much anymore, it was used to be caused by an organism called brucellosis. Trauma can cause it as well, but fistulous withers, they get draining tracts above the withers, and some of the equine vets will talk to you about that this weekend. So know those bursa. Here's our picture. There's a bursa above the atlas. Here's the one that's not always present above the axis, and here's the one, the supraspinous bursa, above typically T2, T3 region right here in the withers, the height of the withers. Here's a laminar portion of the nuchal ligament, and here's this funicular portion. The horse's head's here in this picture. Again, here's a laminar portion. I'm sorry, the funicular portion right here. Here's a laminar portion. There's that bursa, typically above T3. And you can see how well developed this nuchal ligament is in the horse, and the dog is mostly just a fibrous band that attaches to the axis. In the horse, it does attach to the EOP, actually attaches to the head. The atlanto-occipital joint between the atlas and the occiput is a synovial diarthrodial condylar hinge type of joint. It's condylar because the shape of the articular surfaces are actually condyles, the condyles of the occiput, right? But its primary function is hinge, flexion, and extension. There is a joint capsule there. It is a synovial joint. There are ligaments that help connect this joint together. We're not going to be that concerned with them, but we need to know this joint. We'll work on this joint. Here's a radiograph showing you the condyles. Here's the atlas. Here's the axis. Mastoid processes. Paracondylar eminence back here, but not a very good radiograph. Sorry about that. A musculature of the neck, intrinsic deep muscles of the neck. I won't test you over these, but they're there. They'll be spasmed oftentimes when there's subluxations of upper cervical spines. You can palpate these. These intertransverse area between transverse processes, interspinalis between the spinous processes, are extremely hard to palpate. The multifidus cervicis. Multifidus is not very well developed in the cervical region compared to the lower lumbar spine, but is involved with the extension of the neck. These we should know. These are called the muscles of the suboccipital triangle. These upper cervical muscles. The names are similar to what they are in people. Obliquus capitis cranialis, from the wing of the atlas to mastoid process. It's going to extend the occiput on the atlas. You want to palpate these muscles, and we'll teach you to palpate these in a topographical lab. As well as the dog lab will do that. You palpate these, the animal will flinch. Oftentimes a horse will stretch his neck repeatedly when these muscles are spasmed. This is seen with atlas subluxations. Obliquus capitis caudalis, spinous process of the axis to the wing of the atlas, very similar to the obliquus capitis inferior of dogs. Of humans. These both obliquus capitis caudalis is both present in the horse and in the dog. This rotates the atlas on the axis. And again, spasms of these muscles, you're feeling for tightness on one side versus the other side, decreased motion, range of motion. Rectus capitis dorsalis major and minor. These are synonymous to rectus capitis posterior, major and minor in humans. The minor from the spinous process of the axis to the occiput. The minor from the dorsal arch of the atlas up to the occiput. These are going to extend the head. So the rectus capitis dorsalis major and minor. Now in humans, there's correlations between these rectus capitis muscles and the dura mater of the cranial dura. And so spasms of these muscles caused by upper cervical subluxations actually cause pressure and tension on the cranial dura, and part of the cause of cervicogenic headaches. Now, do animals get cervicogenic headaches? We don't know for sure, but I would presume they would because of these muscles that are involved there. These muscles, the obliquus capitis muscles and rectus capitis muscles, are richly innervated with mechanoreceptors for the purpose of obviously telling the animal where his head is in space in relationship to the body. So these are critical muscles as far as knowing them and understanding their relationship to the cervical spine. Here's pictures. Here's a rectus capitis. This is a dog, obviously. Rectus capitis dorsalis major. Here's obliquus capitis caudalis. Here's obliquus capitis cranialis. So there's your triangle, what they call the suboccipital triangle. You can see that here. Okay, we're back. Sorry about that. That's one of the problems with recording in your office with telephones, is telephones ring. So anyway, you can see the suboccipital muscles right here. There's that suboccipital triangle. And these are important muscles, loaded with mechanoreceptors and proprioceptors. There's the minor, which is actually deep here to the cranialis and the major. Serratus ventralis cervicis. This is the muscle that's going to extend the neck, draw the scapula forward. It's located under the traps in the rhomboids. Splenius, intersplenius capitis and cervicis. We usually call them splenius muscles. Don't really differentiate those as much in the dogs as we do in humans. This is going to elevate the head and neck. Again, I won't test you on these specific muscles, but you need to know they're there. There's a splenius. There's a serratus ventralis in the horse. Longissimus capitis, part of the longissimus muscles. The longissimus muscles is one of the major paralumbar muscles, paraspinal muscles, involved with extension of the spine. This muscle, the capitis, is going to actually attaches to the head. It supports the cervical spine. Semispinalis capitis is the major extensor of the head and neck. Here in the dog, this is a dog view. Here's sternocephalicus. Dogs don't have a sternocleidomastoid, neither do horses. Okay, so they have different muscles, but here's a sternocephalicus from manubrium up here up to the mastoid process. So kind of similar to the SCM that we find in people. This muscle is going to flex the neck and head, going to lower the head. Here's a sternocephalicus of the horse. Here's a trapezius. The jugular furrow, I mentioned this, is such a prominent thing in the horse. Not quite as obvious in dogs, but this is where oftentimes jugular punctures are done for the purpose of taking blood, sometimes giving intravenous injections. You got to be a little careful because deep to this jugular vein is the carotid artery, and if you go too deep with a needle here and go into the carotid artery and give an injection versus one in the jugular vein, it can create issues. And I've seen injections given that they thought they were giving it in a jugular vein, they gave it in a carotid artery. So instead of going to the body, which is what you want the drug to do, as opposed to going to the head, you give it in a carotid artery, it goes straight to the brain and can cause issues. So the cervical spine of a horse, and of course the veterinarians know this, but the chiropractors, you're going to be palpating way up here. Cervical spine is right along here in the horse, so it's much lower down. The sternocephalicus muscles here, and a muscle called the brachiocephalicus muscles here. So we go back to this picture here. This is sternocephalicus. This is brachiocephalicus. This is your jugular furrow right here. So the sternocephalicus and brachiocephalicus are kind of the quadruped's equivalent to sternocleidomastoid. Not exactly, but close. Sternothyroideus, sternohyoideus, omohyoideus. These are muscles ventral to the trachea. Sometimes these muscles are operated on and cut for horses who have chronic cribbing, air-sucking cribbing. Horse hangs onto the crib with his teeth and swallows air, sucks air, and they get addicted to this, and they just do it almost constantly. It can be a real issue, and you can talk to the equine vets about doing that. Trapezius muscle is an important muscle of the spine and the neck, like it is in people. The cervical portion, ligament of nuchae, and the thoracic portion, supraspinous ligament, to the spine of the scapula. It's going to elevate the shoulder. It's going to draw the limb forward, and it's also going to be able to draw the limb posterior caudally. Here's trapezius muscle. Here's a brachiocephalicus. Here's a trapezius of a horse. This trapezoid-shaped muscle. You'll palpate these muscles in lab. Rhomboids, they don't usually say rhomboid major, rhomboid minor, call them rhomboideus muscles, if you will. It's deep to the trapezius. Everybody with cervical nerves. You can see problems with decreased power, lack of coordination. The animal may have a shortened stride in the front limb. But again, you're thinking lower cervical subluxation is causing this. So check the lower cervical spine if you suspect rhomboid problems. Triceps innervated by radial nerve, just like in people. Triceps is on the caudal aspect of the scapula, deltoid tuberosity of humerus. It's going to attach onto the olecranon of the ulna. It extends the elbow and flexes the shoulder joint. Innervated by radial nerve. I've seen several dogs with issues with the triceps, inability to flex the elbow. These dogs may have an extension, a chronic extension of the elbow joint. They can't flex the elbow because of spasms of the triceps. They're going to resist taking that limb forward into extension. The horse may have lead issues, maybe be lame at trot, things such as this. We'll talk to you about gait abnormalities and things associated with triceps brachii later on. So here's a rhomboids deep to traps. Here's a triceps. The brachiocephalicus, which we mentioned before to you, mastoid process, nuchal crest of the skull, wing of atlas down to deltoid tuberosity and fascia of the neck and shoulder. It's going to flex the neck laterally. It's going to draw the limb cranially. So it's kind of the other part of the sternocleidomastoid. Not exactly, but kind of, if you will. Brachiocephalicus, it tells you from arm to head. The muscle tells you where it attaches. Here's brachiocephalicus. Here's trapezius. Rhomboids are deep. Here's brachiocephalicus. Here's sternocephalicus, brachiocephalicus, pecs. brachiocephalicus of the horse right here, sternocephalicus here, jugular furrow here. Latissimus dorsi. Latissimus dorsi is going to flex the shoulder, inserts on the humerus, innervated by the thoracodorsal nerve. Here's lats. Wide back muscle. Trapezius, here's a lat of a dog. Pec major, pec minor, just pectoralis muscles in general. It's going to adduct the front limb. It's going to advance and retract the leg. It's a major muscle of locomotion to the quadruped. Not so much with us, but it will move that limb, stride backwards. It's going to flex the limb. Pectoral nerves. An animal will have a short extension of the front limb. It may refuse lead. It may have pain. Especially whenever you tighten the girth of the saddle around the horse, it may flinch due to problems with the pec and the horse. Here's the pecs of a dog. Here's the pectoralis muscle of a horse, and here's one on there's the pectoralis muscles. Adductor involved in locomotion of that horse. Everybody have pectoral nerves that come off the lower cervical spine. Serratus ventralis, very similar to serratus anterior in humans. Lateral surface of the first 9 ribs to the medial scapula. This muscle is involved in supporting the trunk. There is no osseous attachment of the front limbs of the horse or dog to the rib cage, to the thoracic skeleton. So the thorax. So the front limbs basically just kind of hang there off the rib cage, and this is an important muscle in supporting the trunk. We'll show you this pictures here of the support in a second. But it's innervated by a long thoracic nerve. Here's a serratus ventralis. You see the serrated appearance to it. The girdle muscles join the forelimb to the trunk, and this is a synsarcosis. The word synsarcosis, syn means union, sarco means flesh, so it's a fleshy union, if you will, of the front limbs to the thorax. There is no osseous attachment like there is in people. People have a clavicle, and that clavicle attaches that upper extremity to the thoracic skeleton. Dogs and horses don't have a clavicle. So they don't have that osseous attachment. It's all muscle. But the serratus ventralis and pectoralis muscle form a sling, if you will. And then the rhomboids and the trapezius stabilize the scapula against the forces trying to abduct or take that scapula out to the side. And I'll show you a picture here. So here it is. So here's the rib cage. Okay. Here's the pec muscles. And here's this serratus ventralis muscle. And you can see it attaches to the scapula and into the ribs. It just suspends that thorax inside the limbs. Okay, here's rhomboids and traps holding the scapula tight against the thoracic wall. So because the scapula is going to want to protrude laterally or abduct. So he's hold it tight here. The serratus does the same thing, helps suspend this, so you just kind of slung. It's like it's slung in this sling right here. So any cervical subluxations causing issues with these muscles are going to affect the entire animal's gait and suspensory apparatus here. Here's a great picture showing you all the muscles of a horse, so that you can look on here and see these from the previous discussions that we had. The serratus ventralis. Here you have your intercostal muscles. A little bit of neurology here. There's 8 pair of cervical nerves. There's only 7 cervical vertebrae, but 8 pair of nerves. C1, the first cervical nerve, the dorsal branch, is a suboccipital nerve. There's no cutaneous branches here. It innervates those muscles of the SOT, the suboccipital triangle. The ventral branch goes along and contributes to the ansa cervicalis, which you remember is that loop in the neck, along with cranial nerve 12. Innervates the hyoid muscles that move the hyoid bone. Kind of a complicated looking picture, but it shows you here's the cervical plexus, here's the brachial plexus. Okay, and you see the formation of the nerves like the radial nerve, the median nerve, the ulnar nerve. Okay. Here's the cervical. Here's this ansa cervicalis, this cervical loop. Greater occipital nerve for innervation of the posterior scalp. Greater auricular nerve, innervation behind the ear. C2, the dorsal branch is greater occipital nerve. It's the skin of the dorsal aspect of the temporalis muscle and some of the skin of the ear. The ventral branch divides into transverse cervical for skin of the ventral neck in the mandibular space, and the greater auricular nerve, which is skin caudal to the ear. Pinna means the ear itself, the actual ear. You can see here's the innervation. Here's greater auricular nerve, greater occipital nerve. So here's greater auricular, here's greater occipital. There's an overlap between those two just as far as checking dermatomes. Another picture here showing you the innervation of the greater auricular, greater occipital nerves and the cervical plexus. Transverse cervical nerve for skin of the anterior neck. Dorsal branches of C3 through C7 nerves. As you go caudally, they get smaller and smaller, but they're going to innervate the muscles of the dorsal neck and the skin of the dorsum of the neck. Here shows you dermatomes, C3, C4. There's overlap, lots of overlap with these, obviously. Ventral branches, C2, 3, 4, and 5, supply skin of the ventrolateral neck and muscles of the neck like the longus capitis, longus coli. These are flexors of the neck. Brachiocephalicus. Phrenic nerve in dogs is C5, 6, derived from C5, 6, and 7. C3, 4, 5 in people. 5, 6, 7 in dogs. Obviously going to innervate the diaphragm muscle for breathing. Lower cervical subluxation is going to affect the phrenic nerve, affect the respiration of the dog. We'll cover the brachial plexus more when we cover extremities. We'll get into radial nerve, median nerve, things such as that at that time. We'll come back to that. Cranial nerves, we use them as diagnostic indicators to help us, spot different nervous system disorders. We talked about cranial nerves last time, cranial nerve testing, different things. There's 12 pair of cranial nerves in animals like in people. I would refer back to your notes on sacropelvic module for specific neuro exams of these cranial nerves. We talked about the cranial nerve exams last time. Cranial nerve 1, olfactory nerve, smell. It's an important nerve in animals, especially your carnivores that are using, especially dogs, are using these smells to track game, things such as that. Cats who can't smell typically will not eat. So it's very important for cats, and infringement of that airway, the upper airway, creates issues. Also, many animals don't want to breathe through their mouth, so nasal congestion can cause mouth breathing, and a lot of animals won't do that. They just won't breathe through their mouth. Optic nerve, obviously, is sight, and results, obviously blindness results from this. It's hard oftentimes to tell a blind cat or dog. They're so good at adapting and so good at sensing their environment with their whiskers and with their other senses. It's very difficult to tell a blind animal sometimes. Oculomotor nerve is going to move the eyeball. Most of the extrinsic ocular muscles are cranial nerve 3. The cranial nerve 4 innervates the dorsal oblique. Cranial nerve 6 innervates the lateral rectus. All the rest of them are cranial nerve 3. Injury is very uncommon here. We talked last time about Horner's syndrome just a little bit. Four clinical signs of sympathetic defect of the eye. There's miosis or constriction of the pupil. In ophthalmos, a sunken eye. Get this ptosis or drooping of the eyelid, and usually the prolapse of the third eyelid or nictitating membrane. So this is all signs of Horner's syndrome, which is loss of sympathetic input due to damage of the upper thoracic, lower cervical, upper thoracic spine, primarily T1, because that's what supplies sympathetic input to the head. Cranial 4, trochlear nerve, dorsal oblique muscle. I don't think you're going to see damage that very commonly. Cranial 5, trigeminal nerve, sensory to the face. It's the largest of the cranial nerves. It is sensory to the face and motor to muscles of mastication. It has three divisions: V1, V2, V3, the ophthalmic, the maxillary, and the mandibular divisions. Chronic facial irritation can cause issues here. Get paralysis and atrophy of the muscles that raise the jaw or elevate the mandible. You get drop jaw. You can have spasms here. You can have actually spasms where they almost get like a locked jaw. Shows you cranial nerve 3. Foramen ovale. Here's the infraorbital foramen. There's a mental foramen. Here you have the supraorbital foramen for the three branches: ophthalmic, maxillary, and mandibular divisions of cranial nerve 3. Cranial nerve 6, abducens nerve for lateral rectus muscle, rotates the eyeball laterally. Cranial nerve 7, facial nerve, supplies muscles of external ear, digastricus, things such as this. It's in Bell's palsy, causes paralysis. You see this dog's got drooping of this whole side of his face. You got to watch the eye. They can't blink their eye, so you have to worry about keratitis, Zika, dry eye in these animals. There's facial nerve. Cranial nerve 8, vestibulocochlear nerve. You get head tilts in dogs. Cochlear nerves is the sense of hearing. The vestibular portions balance and equilibrium. There's a maneuver called Epley's maneuver, which can reset the labyrinth of the middle ear. It's an interesting procedure. I've never read anything specifically done on it in dogs, but you can try it. At some point you can look up Epley's, E-P-L-E-Y-S, Epley's maneuver. Always think about middle ear infections in these dogs. Always think about trauma. Oftentimes these dogs have a nystagmus. This is really a workup for a veterinary neurologist. Peripheral vestibular disease, head tilt is to the side of lesion. Okay, these in severe cases, this dog's got a severe case. They'll fall and they'll circle to that side. They're ataxic. And I've adjusted a lot of these dogs, and some of them I think we've helped. Provided there's no underlying infection like miliary infection, tumor, things like that. Cranial nerve 9, glossopharyngeal nerve, parotid salivary gland, large gland right at the base of the ear. It's sensory motor to caudal tongue, parotid glands, pharynx, carotid sinus. These animals can have difficulty swallowing, gagging, things like that, laryngeal paralysis, snoring, roaring, it's sometimes called. Always think whenever you have an animal who's having swallowing difficulties, though, just put this little note here. Always think about rabies virus. Just be safe, on that. Vagus nerve, cranial nerve 10. These animals can also have difficulty swallowing. Can have megaesophagus, which is dilation of the esophagus, and these dogs will regurgitate. They don't vomit, they regurgitate, which is a little different. Degeneration of recurrent laryngeal nerve in horses and dogs also. This causes roaring. It causes that they cannot abduct the arytenoid cartilages and vocal folds here, so they get this closure. It's almost always limited to the left side, which is where the recurrent laryngeal nerve comes around. But you get this roaring, snoring in these animals. Seen a lot. I've seen at least my fair share in Labradors for some reason, and horses as well. So this degeneration of the recurrent laryngeal nerve causes roaring, and they get this noise, this inspiratory strident noise, this inspiratory roar when they breathe in. Cranial nerve 11, accessory nerve. It has two roots, the spinal nerve roots, and also the cranial nerve, the cranial component. So you have the two components. Again, it innervates the sternocephalicus, the brachiocephalicus, trapezius. The trapezius is the biggie here. But you got the upper cervical components that can be involved in cervical subluxation, so always check this. Hypoglossal nerve, cranial nerve 12, comes out the hypoglossal canal, which is just right above the condyles of the occiput. And dogs here can have paralysis of the tongue, usually deviates toward the normal side, because the ipsilateral paralysis causes deviation of the tongue toward the normal side. And you see this a lot of time. Papillons, for some reason, have their fair share of this. And lastly is the cranial nerves that carry parasympathetic fibers, 3, 7, 9, 10, just like in people here. And just remember this for those purposes. And if you have any questions, please let us know in class, let us know in lab, and have a super great day. See you in class.